Hi, welcome to episode 2 of the Recovering Artist Podcast. My name is Dita Casey, and today I'd like to welcome to the show Suprna Damany. She has been my ergonomist, helping me with my RSI for the past years since 2021. So, Suprna, why don't you introduce yourself and tell our audience what you do?
Hello. Thanks for having me on the podcast. I'm a physical therapist by profession and an ergonomist and a hand therapist and a few other things. But I guess my passion is the treatment of repetitive stress injuries and chronic pain treatment in general, everything from headaches to foot pain and everything in between. I was educated in India, partly. I did my undergrad in India, and I did my graduate work at Temple University in Philadelphia. So, in a sense, I sort of blend the Eastern and Western techniques in my assessments as well as in my treatments.
Okay, well, I guess part of what I wanted to talk about today was what happened to me with my RSI journey. Because I don't know, did you finish watching all the episodes or on my other YouTube channel? Or if not, I can just go over like a brief rundown of what happened, then you can explain from your perspective. So basically, what happened with me was I started having symptoms of repetitive strain injury back in 2021 because I was working on my art projects. I didn't know about stretching or anything like that. I was having horrible posture, had my neck down, looking at my screen tablet, and I didn't know what was causing it, and I was like, I could feel the tingling in my pinky and my ring finger, and I'm like, oh, I'll just wear a brace. Maybe it will go away, you know? And I didn't understand the connection between the neck and the hand. And then things got worse because I was doing a very bad diet, which ended up weakening my muscles further, but I didn't know how bad it was going to be until I had all these reoccurring injuries over and over again. And then I finally had enough, and I was looking for help on the internet, and I stumbled across the Damany Center, and I gave it a try because I had experienced several injuries in my hands, and then along the way of my journey, I kept injuring myself because I was still doing the diet, and I ended up getting a bunch of like scar tissue from it. But finally, after a few years of trying to figure out what's going on, I finally realized my diet was the source of it. And then things started to rapidly improve to where I am at right now, where I'm steadily recovering, and I'm working on my art, and I'm working on building my strength up. So that's my story in a nutshell.
Okay. I guess, did you find that you were still doing the diet when I was giving you the program to follow?
Yeah, that's the thing I was going to talk about with you, because I didn't know that the diet was so bad when I was meeting with you guys for the first time. I was kind of like brainwashed into thinking that I had to do this in order to lose weight, and I wasn't going to hear anyone else's opinion on it. I thought I knew exactly what I needed to do, so I was so stubborn. And even my mom was telling me, this doesn't seem like the right type of diet you should be doing. You're probably injuring yourself because you're eating, you're eating. You're not eating your carbohydrates. And I'm just like, no, I didn't want to hear it because I had success, but it came at a cost because that I was already in a weakened state. Because I was just thinking back one of the times when I had met with you and I had told you that my wrist had gotten twisted when I was using a drill, and you're just like, that doesn't seem right. And I'm like, duh, because I'm a diet. I didn't realize it until like several years later that there was several like red flags that I realized that were popping up. So I didn't know how bad it was until I kind of realized that, hey, my muscles are injured. What type of diet do you need to eat to, help your muscles recover? And of course it's like, oh, carbohydrates. I'm just like, so yeah, I was unknowingly doing, this stupid diet. Well, you guys were trying to help me, and I didn't think that it mattered enough, or I didn't tell you guys what I was doing because I didn't think
Mhm.
that it was a problem. And then, of course, everyone was trying to figure out what's going on. Why is she like having so much trouble? Like, what's wrong with her? And it's because of the diet. So that definitely was something I had to learn the hard way.
Yeah, I mean, I obviously nutrition is important and hydration just as well. But I think that, when you started this conversation, you talked about your symptoms from using the computer and looking down and, how
Yeah.
you have feeling and numbness. And I think, with repetitive stress injuries, I think that, um, all those factors are really important because human bodies are meant to move. We're not meant to be static. And
Mm-hmm.
we're not meant to do repetitive work with our hands. The kind of fiber we have in our forearms is only meant for short, intense bursts of activity. Um, and so, you're sort of doing something that you're not even built for. And the only way to make that tissue fatigue resistant is by increasing the blood flow. So, when you talk about posture and ergonomics and, repetitive movements and changing how you're using your computer or how you're moving your body for that matter, um, I think the aerobic activity, like I think for me is the number one factor in starting to heal because without blood flow, if you want to reduce it to a very basic level, it comes down to blood flow and oxygen, right? So until you have that, you really can't start healing. And, to start healing or to build up strength or endurance or even get back to your original activity level, you have to have health to the tissues and to the joints and to the muscles and the nerves because they sort of work together. The muscle and the soft tissue and the joints and the nerves, they work together, they affect each other. So if your muscle's tight or your soft tissue is tight in that area, it's going to pull on the nerve or it's going to push on the nerve. And if the tissue is tight, then it's going to pull the joint out of alignment because that's where it attaches to the joints. If the joint is out of alignment, similarly, it's going to pull on the soft tissue and it's going to pull on the nerve. If the nerve is tight, obviously it's going to scream because, nerves don't have a lot of give. Even though they are slightly elastic, it's not a lot of give. And if a nerve starts screaming, then guess what? The muscle is going to get tight and the joint's going to get less mobile to protect. So these three things affect each other, if you want to look at it physically, right? And then physiologically, underneath, there's a whole different thing going on also, because, the first response to any injury is fight or flight. And guess what? I mean, that's the only nerve response we have to any kind of stressor. We have only one nervous system. So, it's the fight or flight system kicks in when you're in physical stress. And the result is a tightness of the tissues and a reduction in blood flow and, secretion of certain hormones, which is all counterproductive to healing. And then underneath it all, when you start getting really chronic, these things happen, they're cumulative. They happen over time. And like you said, it's hard to find help. Which to me, really baffling because I've been doing this for like almost 3 decades now. And I just don't see a change in where there is an understanding of this and there are appropriate treatments. And usually, in my clinic, I see people who've been everywhere, done everything, and sort of are coming to me as a last resort. So, like I was saying, the third layer is actually the chronic condition, and where, it's almost like there's a demand and there's an effect, and there's a stimulus and there's an effect, and this happens every single moment of every single day. And it's almost like that response gets hardwired into the nervous system, where the nervous system starts secreting neurotransmitters and creating receptors that catch these neurotransmitters and creates this whole system because it thinks this is normal now. So when you're trying to heal this, you have to heal it at several levels. I mean, the first is to restore health so that any kind of demand you put on the tissue, even in terms of stretches or nerve exercises or muscular exercises, the body has to be able to supply that demand, and it's not going to be able to supply it unless there's health. And then once the health is established, and the alignment is established. I mean, imagine strengthening a joint that's misaligned. You're just going to strengthen the wrong alignment, right? So timing becomes really important in this. So you first restore health, then you start preparing the body slowly for demand, which is strengthening. Because yes, strengthening is very important. That's what's going to give you the ability to fight recurrence, and the ability to challenge yourself with activity. But, the typical response that I've known in the healthcare community when, someone goes with these symptoms to a healthcare professional is, oh, you need to get stronger because you're weak. Of course you're weak. This happened over time, and you progressively reduce your activity level, right? Because, when you start hurting yourself, then you start reducing what you do. When you reduce what you do, then you get even weaker, because you're not using those muscles anymore. And, and the other thing that happens is that you start sort of taking the pleasure out of your life, because work you have to do, but pleasure you can compromise on. And that's not great for the nervous system either, So you're looking at a syndrome which is really multifaceted. And I think that if you don't have a multifaceted approach to this condition, you're not going to get anywhere. So I think that's the key. And actually, I call it my next book is going to be about chronic pain and connecting the dots. And I really do believe that it's not like the information is not out there, or that there are not practitioners that do a little bit of all that's needed. But this becomes a whole syndrome where, sometimes the whole body gets involved. And unless you treat all the pieces of the puzzle, you're not going to make the picture. You can't make a picture out of a puzzle if a few pieces are missing. And I think that's really the key to treatment, that you sort of have to get a holistic look at each person, because each person's different. Every person, obviously activities are different, so therefore the body parts injured will be different. But every person also compensates their own way, because the body is this amazing compensating machine. And as you hurt something, the body just starts using something new, and then if you hurt that, then it recruits something else. And this is how, you feel like the syndrome is spreading, but it's really just your body trying to cope and trying to allow you to function as much as possible. And usually when you get symptoms, it's already a little too late, because the body has completely compensated. And so now, you come to me with these symptoms and the syndrome, and that's normal for your body. And, the trick is to teach your body a new normal. And any re-education takes consistency. And this is re-education not just of the muscles, but also of the nerves and the joints and the body's, patterns, movement patterns, and then ultimately the nervous system, which, there's obviously, we talked about the hardwiring of the nervous system that goes on because of demand. But on the flip side, there's the fear of not knowing what the syndrome is, what's happening to me, the anxiety, that goes along with it. And like I said, we only have one nervous system, and everything is processed to this one nervous system, which gets completely overloaded. And so there's a lot of retraining that's required of that nervous system. So again, just like there are many layers to the problem, there are many layers to the solution.
Definitely.
Mm-hmm.
Yeah, I remember when I first was on this journey of recovery, I was so stressed out because I didn't know why I was having all these symptoms, and it was so mysterious. I didn't understand why. I didn't even know what muscles were getting angry or stressed out, or like what. I'm like, oh, it just hurts in this spot, but what is this, And I tried to look it up myself and do research, and then just made things worse.
Yeah. And isn't that actually a little completely baffling? Why we are in this state, and this, this day and age, that, people with chronic pain are not getting any help. And of course, I'm talking about chronic musculoskeletal pain, because other types of chronic pain too. But, I mean, my first book was 25 years ago, and, I've been treating this condition and seeing desperation in my office
Mm.
for 25 years. And, it just confuses me why this is such an issue, because really the, the syndrome is very, very logical. And so is the recovery. It's very predictable in a way. So I don't understand why this is not something that is, widely available to everyone.
It's confusing. It's like there's no teaching about preventing it either. Like I didn't have no one said anything about repetitive strain injury in art school, and we all sat at our desks. We all sat hunched over our computers,
Mm-hmm.
and there's no talk about ergonomics at all. And I didn't even realize ergonomics were a thing until I found your book, and I'm like, what? I'm like, how
Yeah.
your body can do this now?
And even so, that's just one piece of the puzzle, right? I mean,
Yeah.
furniture is going to solve all your problems. There's, it's how you use the furniture and, what you do with your body. Because listen, any amount of, even in a great position, prolonged time in a great position is still going to be bad.
Yeah.
So it's a lot about how you use your body, how you use your mind, um, and with good ergonomics. So again, many facets to this issue, but it's something that I think you brought up a good point. Prevention, because prevention it's really easy to prevent this, but prevention is a difficult sell, and it's something simple that could solve a huge problem, but it's certainly not done. And I think that right from schools we should really start trying to prevent it, because it is easily preventable.
I think all public schools should talk about it. Even it doesn't matter if you're going to be in a artistic field or doing
Yeah.
something else. Like there's people are going to have bad posture no matter where they go if they don't learn it. And like other things like
Right. Right. I agree with that. I don't think that we are teaching our kids, how to hold their bodies and what's healthy and what's not healthy. And now that we have tablets and video games and cell phones, I think it's getting even worse. And I've seen it in my clinic. I've seen it when I first started. The average age of my clients was like in their 40s. And now it's coming lower and lower and lower. And my youngest has been 8.
oh wow.
Yeah, just spent all summer playing Game Boy. And by the end of it, he couldn't turn his neck, had numbness in his arm and headaches. So, I haven't seen too many of those, thankfully, but certainly, high school and college age. I mean, I've had clients who had to quit college, move to Allentown to get treated,
Oh
so
wow.
they go back. Several PhD students, because that's a grad school, can be pretty computer intensive.
Yeah, pretty
Uh,
tough.
and, of course, anyone using the computer or, um, even
Type.
artists drawing, typing, painting. But I see people from all fields, because there's not much we can do without the computer these days. And I see a significant amount of doctors who are using electronic medical records now. Of course, there's dentists, dental hygienists, hairdressers.
Oh
There's
yeah.
lots of professions that use a lot of repetitive activity, static posture, poor positioning, all those. So it is I think it's such a major part of our lives, and it should be getting so much more attention,
Definitely.
but it doesn't. And I don't understand why. And honestly, I don't even think they're teaching it in school,
Yeah.
because to look at, years ago, I read this quote, which I thought was really funny and really apt. And it said that specialization is knowing more and more about less and less, till you know absolutely everything about nothing. And I thought, oh, and this was easily 20 years ago. And I thought, oh, this is so apt, for what we do, because we are getting more and more specialized. And this syndrome is, it just shows, in fact, it's a great demonstration of how interconnected our body parts are and how they, work with each other, they interact with each other, they affect each other, and not just the body parts, but our body systems, like the endocrine system, and the immune system and the GI system and your autonomic nervous system. I mean, these are all connected. They work, they affect each other, they interact with each other. And, so I think that in a world where, we want to be high volume and spend less time and, with patients and with, in a world where you just don't even learn about treating in a more holistic way and treating the whole person rather than just the body part that you see. I think I can see in this world where this can be such a problem, where you just, if you don't have the knowledge, it's almost like, oh, you have chronic pain, here's some medication and just go away, and if you want more medication, come back because I don't know what to do with you.
Yeah, the doctors just they couldn't see anything wrong with me, and they're just like, oh, some people just have to live with pain. I'm like, what? I don't accept it.
And that's a good point you bring up too, because a lot of times the tests are negative with this, because it happens over time. It's cumulative. It's like so gradual that the body has plenty of time to compensate. And forming scar tissue is one of the ways to compensate also. That's the way the body heals, right? So it has plenty of time to compensate. And so therefore, the tests are often negative. And, again, we are a test-based society. So the test doesn't show anything, then maybe there's nothing wrong with you. And perhaps you need an antidepressant, right? Because you can't see anything wrong. And that really, is not the case. It's just that, there is reduction in blood flow, but it's not enough that a test might pick it up. There is, nerve issues. There are nerve issues, maybe a compression, maybe a tension, enough to cause pain, but not enough to be picked up on an EMG. So you're right in that space where, you don't fall under any category where they can give you a diagnosis. And it's similar with the treatment. They don't know what to do with you because there is no protocol. And again, we're a protocol-based society. And to me, protocols, I mean, humans don't fall under protocols. Like if it's an orthopedic injury, like an ankle sprain, then maybe, maybe a bone break, okay, bone will heal in the next amount of time, but not this condition. It doesn't, there are no protocols for it because each person is different. And I think that can frustrate a lot of healthcare practitioners, who just want to, just want to dole out a protocol and have it work. And, that doesn't work here.
It's like they kind of just want to do a one size fits all, and if you don't fit what they want to treat you for, then you're just going to be shown to the door.
Yeah, because then it's your problem, because you must be the problem because their protocol doesn't work, right? So it's a very different philosophy of treatment. I think that, if something doesn't work for me, I usually say, okay, what are you missing? Because I know that there is something that I'm missing, which is why, my client's not getting better.
Yeah, like my missing piece was my nutrition and my diet, and I didn't know that it was the missing piece. So you guys were still trying to help me, and that puzzle piece, I was holding it, and then when I put it back in, I'm like, oh, okay, I get it now.
Yeah. And, so again, like I said, we sort of stuck in there with you because we kept thinking, okay, there's something we're not getting here, or, there's something, we need to do differently. And there is a somewhat of a trial and error process with this because everyone is not the same. Every syndrome is not the same. And it's really quite interesting and exciting and challenging if you like that kind of stuff. If you want to see, 3 patients an hour, then I don't think that this is something that you can do.
Well, I mean, the type of work that you do is like you help them get their life back, because a lot of them, like me, I was just like, am I just like doomed? Am I just never going to be able to do what I wanted to do anymore? It's like, so it's like you give them hope when you see them. So it's probably gives you a feeling of rewarding, a feeling of joy, when you can help them.
I mean, it's really, first of all, I think that I do what I know best and I'm happy to help, but I could never do it without you, right? I mean, I give you a program to follow. You have to follow it. If you don't follow it, then nothing I do is going to help. So I always say the credit really lies with you. If you're better, the credit lies with you. I can guide you, but I can't get you better unless, we're a team, right? So that's one part of it. But I guess I just lost my train of thought.
That's okay.
But I had something important to say. So we were talking about treatment. Getting someone's life back.
Yeah.
I said that, no, I can't do it without you. But, it actually is. It's actually amazing to watch the body heal. I think that's what I love most, because it's almost like you watch a miracle, every time, to see where someone comes from and to see what their body can do after you just had to push it the right way, right? And at the right time. And there's this sort of like this process, even though there's no protocol, there is a guideline and there's a process. So just to, have that, just to constantly see what the body can do, I think that's really my high,
Yeah.
because I just love watching it, just change. And it's so plastic and it's so receptive to the right treatment. And I mean, listen, I've been doing this for almost 30 years. So if I have faith in the body's capacity to heal, it's because I've seen it. And so, which is why I think when someone doesn't get better or isn't getting better or is stuck somewhere, my first question is, okay, what you're missing? Because this body can do it, but you're missing something. Yeah.
I think like your confidence and because you've seen so many people heal, that I think that sometimes when you, obviously, if you're going to see that person in person, like your energy will affect them and they'll be like, hey, I can do this, because you have utter faith in the human body healing, and that gives them hope. Like that, when you told me I would be able to draw again, I'm like, okay, she knows what she's talking about. I'm going to trust her.
Well, good. And now you're drawing again. So
Yes, I am.
this is what makes me happy, that you're doing what you love, and you did what you were supposed to do, and you attained your goal.
Yeah, we're still working on being consistent and making sure I get my drawing sessions in every day, and hopefully I'll be able to like get through the next hurdle. Like, because I'm finally. It took me a long time to gain the strength back when I lost all that momentum with the diet, and then like as soon as I started eating like complex carbohydrates again, I noticed an immediate difference in how my body felt, and then I was able to recover and start lifting the weights again, and I'm back to lifting over a pound now. We were gonna try doing a 1.5 pounds, but it was just a little bit too much. I'm doing 1.25. So I'm using these. I'll show you. Eric and I figured out if I use fish weights,
right. Tell me about that. Yeah.
Attached to my dumbbells, then I can gradually increase the weight without like having to like bridge that gap between the 2 and 1 pound weights. And those fish weights really, really, really had my back, because I used those to like back when I was like barely, like I was like only lifting like 4 ounces of weight, and I'm just like, what is going? And I'm like, wow, I'm like 4 ounces, but now I'm back up over a pound, which is, it doesn't seem like much, but for me it's a huge jump from where I was, because I was my lack of knowledge of like what a really bad diet can do to your body. I was just like, wow, I did not realize that my body was basically going to cannibalize itself. I'm like, oh, so
Yeah, yeah. And it does get easier after you get past a certain point. The inertia is always hard, right? So to
yeah,
get to initially when you start exercising, it takes, you have to get over that inertia. And then once you get to a certain point, it just starts going a lot faster. And then
yeah,
listen, endurance is activity specific. So, if you want to build up endurance to an activity, then you have to do that activity. You can't run a marathon by training on the bike. If you want
yeah,
to run a marathon, you have to run. And it's the same with this. So whatever activity you want to do, you have to, in very small increments, build that up so that your endurance builds up. Because the endurance fiber takes a lot more time than the strength fiber.
yeah.
So so it's gonna you have to give it more time.
You can't just like you have to be patient, and it's like sometimes with artists, it's hard to pull back and stop when you're really getting into something, and it's like I already set my timers, and I usually have to stop. And usually if I go over, I'll feel the fatigue in my arms, and I'm like, okay, yeah, because I'm at that little balance point. I'm like, I have to keep it balanced with everything before I can like. It's like I'm here with my weights, and I'm here with my time that I work with my art, and I have to like when my weights increase, then I can probably increase my art time a little bit, to reflect the muscle endurance and strength building, because definitely Eric has me lifting weights for endurance. Obviously, I'm not I'm not trying to get like shredded here. I just want to drop.
Yeah. And like I said, you have to do it in small increments. Always just a little bit at a time. But yeah, it's hard to get away from something that you love. And also, you've suffered for so long that now that you're finally back to doing what you want, you just want to, run with it, right? So
Yes.
you always have to remember, how long you suffered and how short it's been actually, that in the short period of time compared to how long it took, that look what your body's done. It's amazing.
So I have another question about the scar tissue for digital artists, because uh, I'm experiencing it, and I just thought I'd like you to explain what it is and how it affects people's ability to do their activities and their like repetitive actions, and like what is it? How does it affect people, and like how can people deal with it?
Okay. So scar tissue is really just the body's way that heals tissue that's damaged. So think of it this way, like, when you're doing, as a digital artist, you're doing, I don't know, millions of repetitions, either holding, working on your tablet or clicking the mouse, right? So what happens is that, yeah, so it's when I said it's cumulative trauma, what happens is that there's damage at a very microscopic level because we're just not meant to do this kind of work, right? We're not built like that. So there's a little bit of damage. And then, you sleep at night and it heals, and then the next day you work and there's a little bit more damage again. And maybe this time everything doesn't heal. Maybe just a part of it heals when you rest. Do you feel the symptoms? No, because it's microscopic. And this goes on. So there's damage and there's repair. There's damage and repair. And basically, what happens is that there's an imbalance between the damage and the repair scale. So the damage is way more than the repair. And this way, the damage keeps accumulating till, it's enough to cause symptoms. Now, oftentimes, somewhere in the middle there, your symptoms get intermittent and you get symptoms and then you rest it and then it go away. Then you forget about it, So it's not like the body's not warning you. It is. We're just used to ignoring warnings that our body gives us. So gradually this, damage accumulates and the body is trying to repair. And how does it repair? It repairs with scar tissue. So now you're getting these microscopic areas of scar tissue just because the body is trying to heal. And it's scar tissue is like, imagine, when you cut yourself and you get a scab, right? And then you see the scab start shrinking as it heals. Scar tissue does the same thing. It starts shrinking. And as it shrinks, it pulls everything with it. So now your nerves may be stuck in the scar tissue, you know. Now, if in the interim, before it gets bad, if you catch it and you start stretching and doing the right exercises, the scar tissue will stretch and it'll be molded in a way that it's not going to affect you. But if you don't do that, then the scar tissue builds up enough and it contracts and it starts pulling things with it. So now you have these lumps in your tissue that you may be able to feel. And a lot of times they're right along your nerves, and that causes the nerves to get compressed or tensioned. And now you have symptoms. So a lot of what needs to be done is to break down the scar tissue, because you need to get blood flow to the area, because if there's scar tissue and it's a knot, there's no blood flow getting in there either. So you have to break that scar tissue up. So, manual therapy is the way to go. You catch and break it up. And while you're breaking it, you stretch it, because if you don't stretch it, if you don't do the right exercises at the right time, then listen, with anything you do, the response is the same. The healing response is scar tissue, right? Which is why with carpal tunnel surgeries, a lot of times there are repeat surgeries, because they cut up the tendon, they try and release the nerve, but then they form scar tissue, and then the scar tissue catches the nerve again, and then you have to go back again and get a release, right? So it's important to break up the scar tissue, but at the same time, it's also important to do what needs to be done so that it doesn't scar and contract again, because otherwise you're just running the same circle over and over.
So you guys do the manual breaking up of the scar tissue, so you must have a protocol for stretching afterwards, right? So obviously, because you know if you don't stretch, then it'll just bunch up again.
Yeah. With manual therapy, again, remember that multifaceted, puzzle we talked about. Because manual therapy, the trick with manual therapy is that, when you're treating someone who has chronic pain or chronic injury, there are several things going on at one time. There might be a pocket of inflammation. There might be a trigger point. There might be scar tissue. There might be just fascial tightness. There might be nerve tightness. There might be a joint restriction. So there's so many things going on that really the trick is to change. You have to be able to change your treatment based on what you feel, because you can't treat inflammation the same way you treat scar tissue.
Yeah.
And you can't treat scar tissue the same way as you would treat a nerve under tension. So I think that's the other, gap in our system, because I don't teach manual therapy in schools anymore. And barely anyone even touches you anymore. So there's no palpation skill. And if you can't palpate these different things that are going on in your body, then you cannot possibly be effective with your manual therapy. But yes, the short answer is you can break up scar tissue with manual therapy.
You just have to do it in the right order.
Right order, and you have to know what you're feeling. And for that you need to really have good skills for palpation, which I don't even know if they teach those in schools anymore. So I know they don't really teach manual therapy in schools.
Yeah, when I went into occupational therapy once or twice when I first had my initial injuries way back when, and there was one therapist, when she was doing it on my left arm, because that was the first thing that happened. I had an accident where I hurt my left arm, and I felt it shift, and that was another red flag, and then it caused some scar tissue to form over it, and I didn't know what it was. At first, I thought when I was feeling the scar tissue lumps, it was just fat. I'm like, oh, is that just a chunk of fat? I'm like, the person who was working on me they had a gua sha tool, and they were scraping over it. I'm like, oh, that's scar tissue. I'm like, what is that? I didn't even know that was a thing, and it was a knot or whatever. I don't know if she exactly called it scar tissue, but I'm just like, wait a second, you mean I can make this stuff release, and I'm not stuck with it? What?
Yeah. The one thing I'll just say here is about the tools. Like I'm
Yeah,
not fond of using tools because it doesn't give you the feedback. Like it's really,
usually.
yeah, because you don't know how hard to push, how deep to go. With your hands, you know that okay, this is as far as I can go. This is where the muscle is resisting me. You know, and you can also feel when it's ready for you to go deeper, and you can go deeper. And you don't get that feedback with tools. So,
Yeah, it's like,
I still rely on my hands.
yeah, 'cause you've had probably thousands of patients worth of experience getting that stuff figured out.
Yeah, yeah. I think I pretty much think with my fingers, I think at this point.
Okay. Well, I think I have a few more questions. Like, I think we touched about carpal tunnel. Could you briefly explain the difference between carpal tunnel and repetitive strain injury, and explain how
Oh,
they're connected and how they're different?
well, carpal tunnel is a repetitive strain injury, uh, but it's not the only repetitive stress injury, right? Because the you can diagnose it as carpal tunnel syndrome if the problem is just in your wrist. But you have to remember that the nerves come out from the neck. They come out from the neck. Come to the front of the neck, underneath your collarbone, come out here as a big bundle of nerves in your chest area, which is called the brachial plexus, and gives rise to all the nerves of the arm, right? So, is it possible that there might be compression in the forearm area right here and cause hand symptoms? Yes. Is there a possibility that they could be in the upper arm, in this area where the median nerve passes? Yes. Is it possible that it comes from this area being tight and you can get symptoms in your hands? Sure. Is it possible that neck impingement can give you symptoms in your hand? Yes. So just because you have symptoms in your hands doesn't mean it's carpal tunnel syndrome. If the cause of the symptoms in your hands comes solely from the wrist area, then that's carpal tunnel syndrome. Carpal tunnel syndrome is an impingement of the median nerve at the wrist area. Yeah. So, is there something like carpal tunnel? Sure, of course. Is it a repetitive stress injury? Yes. Is all hand pain, tingling and numbness in the hand, is all of that carpal tunnel syndrome? Certainly not. In fact, in my practice, I see the reason we named the first book It's Not Carpal Tunnel Syndrome is because I would say, very less than 10% of the clients I see have any kind of true carpal tunnel syndrome. And actually, I think I've treated more failed carpal tunnel releases than I have treated real carpal tunnel syndrome. So that's not to say that there is nothing. I mean, my practice specializes in chronic pain. And with chronic pain, I've seen that it's really not such, I see that there's much more overall involvement and it's not such a pure carpal tunnel syndrome. But if you're constantly chopping meat all day or doing, packaging, is it possible that, you can get impingement of the carpal tunnel? Yes. Can it be conservatively treated without surgery? With the right treatment? Yes. Is the right treatment available out there? Really? I don't think so. So again, not it's a little bit of a complex answer, I think.
So basically, you briefly mentioned like chopping meat and packaging things. So it's like, what exactly triggers carpal tunnel in people? Because
Oh,
I never really knew that.
yeah. Well, a lot of wrist movement, this type of
Okay.
thing. Um, any kind of extreme positioning of the wrist. The carpal tunnel pressure has a parabolic relationship to wrist positioning. So this is the least pressure, and as you go up, the pressure increases. As you go down, the pressure increases. So
Ah,
that's why neutral wrist positioning is so important when you're doing things. So any kind of extreme wrist positioning would cause it. Any kind of also gripping activities, because ultimately the tendons are all passing through this tiny little area. So any kind of forceful gripping can cause it. But remember, your body doesn't work in a vacuum. So, rarely you're doing something with your hands and not doing something static with the rest of your body, or who knows what else, right? So it's always important to see the body as a whole, because you could go and operate and release that ligament, right? But maybe you still won't feel better, because if it's coming from somewhere else, or
If
there
you're
are
not,
other areas of the same nerve that are caught up, releasing one area, what's it going to do? It'll just, it'll feel better temporarily, and then that slack is going to just be sucked up by the rest of the nerve, which is tight, right? So then you come back to the same place where you're not feeling anything. So again, it brings me back to where I say you have to treat the whole thing. You have to treat the whole nerve. Only when you treat the whole nerve that can you lift the tension. Otherwise, it just keeps moving.
okay, well, I think that just about wraps up everything I wanted to ask and talk to you about today. So thanks for taking the time to come on to my podcast and talk about repetitive strain injury. And hopefully the next time I have you on, we'll be talking about ergonomics for digital artists. So I'll see you soon next time. So
All right,
thank
thanks
you.
for having me. Bye.
Bye.